Hello everyone, my name is Dr. Biama Neka Onya and I'm a Chief Consultant Family Physician and a Board Certified Lifestyle Medicine Physician working with the UPTH Lifestyle Medicine Center where I happen to be the Director. So today I'm here to talk about the causes and prevention of death after slumping. I'm sure a lot of you have seen that in recent time we've had a lot of unfortunate incidents in which individuals suddenly slumped and died thereafter. So for every known name that succumbed to death in this manner, there are thousands that suffer a similar fate, but their deals go unreported. I don't want to mention names, but we all know what we're talking about. Now, I need to let you know that 70 to 80% of these incidents are attributed to cardiovascular disease, especially in individuals 35 years and older, and the condition is referred to as sudden cardiac death, SCD. And it's more prevalent in the older population, especially among men and among obese individuals who smoke, drink alcohol, and lead sedentary lifestyles, which means they're not active, physically active. So sadly, most of those that suffer from these non-communicable diseases live in the third and fourth world countries like ours, where poverty and stress are rife and where health insurance is ineffective and universal health coverage is a mirage. So here we're talking about ways of making sure that you prevent this sudden death after collapsing. So before we go to that, we need to find out what the specific cardiac causes are. And I'm sure you've heard of heart failure, arrhythmias, myocardial infarction. Arrhythmias means when you have irregular heartbeats. Then myocardial infarction is when the vessels supplying the heart are compromised, so the heart muscles begin to die. Then coronary artery disease is a situation where you have the narrowing of blood vessels supplying the heart, and sometimes total blockage, leading to ischemia and death of the heart muscles, and of course that will cause problems. Then you have what is very common in Africa, hypertrophic cardiomyopathy. It's common in blacks, it's common in young athletes. So then we have what's called the aortic dissection, where you have a tear in the vessel of the blood vessel, the aorta, that pumps, that is responsible for conveying blood from the heart to the rest of the body. And we also have congenital heart defects. These are some of the causes of the cardiac causes of sudden death and slumping. So, but then there are some non-cardiac causes, of course. We have said 70 to 80% are due to cardiac causes. So the non-cardiac causes could be attributed to electrolyte imbalance, when you have, calcium, inappropriate amounts of calcium, magnesium, sodium, potassium, and this could lead to arrhythmias. Apart from that, they could have fluid imbalance issues, and which could actually lead to sudden death and collapsing and sudden death thereafter. Pulmonary embolism is rife, especially when you have what we call deep venous thrombosis. Especially when you're sitting for a long time in a vehicle, you're not moving around, or in a plane or something, and you now have emboli building up, and then they rise up to the lungs, and then they block the pulmonary arteries. So that is something that is preventable, because when you have, you should recognize the symptoms: shortness of breath and sudden chest pain. And by being active and then use anticoagulants if you find that you are at risk. Then stroke, what we call cerebrovascular accident, or which could, especially when it's hemorrhagic, it could be ischemic or hemorrhagic. Now, this can be prevented by optimizing blood pressure control. If the blood pressure is high, there's a greater likelihood of you having hemorrhagic stroke. And then blood sugar control is also very important. So if you're diabetic, you need to make sure that it's controlled. Blood lipid management and avoidance of harmful substances. What are we talking about? We're talking about lifestyle modification. So severe asthmatic attacks could also lead to sudden death, collapsing and then death thereafter. And it can be prevented by avoiding triggers. If you know what triggers your asthma, then you should avoid it and then comply with medications as prescribed by your physician. Anaphylactic reactions, when you have when the body reacts to things like food, like the creams you take, and the things you inhale, certain things could trigger those things off. And if you know what triggers them off, then you avoid those allergens and then seek prompt treatment. Instead of people using video, cameras to video people who have slumped, it's best to take immediate action. Drug overdose is also an important factor, especially for those that abuse drugs, especially opioids, and because it could lead to respiratory failure. If it depresses the CNS, it could lead to respiratory failure, and that's what opioids do. Then septic shock, when all organs of the body, almost all the organs of the body are involved in infection, in generalized infection, then you could have a reduction in blood pressure, leading to multiple organ failure and, of course, death. So what is important is hygiene, early detection, treatment of infections, and judicious use of antibiotics. Hypoglycemia is also an important cause of collapsing and death. And so when we are managing patients with diabetes, we make sure that the control is optimal and that patients are monitored. So, and then whenever you feel dizzy or you have the symptoms, because patient education is very important, then you should always make sure that you have some cubes of sugar available, for prevention and management in the immediate instance. Severe trauma could also lead to that, and so avoidance of risky behavior, especially from car accidents, from fights, could actually be life-saving. And then, of course, wearing protective gear, when you're biking, when you're, in a place where, accidents are prone, especially in a work environment that could lead to accidents, then you need to make sure you insist on wearing preventive gear. Then poisons, poisons could be inhalational, could be ingestible, things that you eat, things that you smell, those things you could intentionally or unintentionally actually get these poisons into your blood, into your system. And what do? They cause organ failure. And they can now, that could actually lead to slumping. Then heat stroke, especially, I'm sure we've heard of cases where there's a lot of, the heat is so intense. And, once it's prolonged and intense, that it could lead to organ failure. And then it can be prevented by wearing appropriate clothing and staying hydrated. So how do we control and prevent and control these unwholesome incidents of collapsing and dying? Since 70 to 80% of deaths following slumping attributed to cardiovascular disease, it only stands to reason that lifestyle medicine is the panacea for prevention, treatment, and in some cases reversal of cardiovascular diseases associated with chronic diseases like obesity, hypertension, dyslipidemia, type 2 diabetes. Those are not the only ones. And what we are talking about now is specific measures that include the 6 pillars of lifestyle medicine. And these include predominantly whole food plant-based nutrition, making sure you have more of whole grains, beans, legumes, fruits, nuts, seeds, and herbs, and then prevent, that has been shown, to prevent, treat, and even reverse chronic diseases. So apart from that, we're talking about physical activity and exercise. So, and then of course, avoidance of sedentary lifestyle. So that is the second pillar. The importance of sleep has been underemphasized by most people, especially doctors who should be actually talking about it. And that's why in my book, Sleep as Medicine, I actually explained in detail the importance of sleep. So Food as Medicine is also there to talk about whole food plant-based nutrition. So if you want to buy that, that's great. Then social connectedness is also very important. Having close connections with people, having people that you can confide in, that's also very important, especially for stress management and, for prevention, treatment, and even reversal of chronic diseases. Stress management, very important through muscle relaxation techniques, mindfulness-based stress reduction. There's a lot of it. And they're all described in Food as Medicine and Sleep as Medicine, the books I authored. And of course, yoga, deep breathing exercises, very, very useful for stress management. And we know that stress is responsible for so many of these chronic diseases. Then avoidance of harmful substances. I mentioned alcohol, cigarette smoking, illicit drugs. All these things are measures that could help you reduce this incidence. Now, other measures include regular monitoring and screening. Like depending on your age and risk factors, including your family history, we could recommend other things we need to monitor. And then adherence to medications should not be underemphasized, cannot be overemphasized. And then weight management, very important. But it's important to note that all these 6 pillars, if you actually practice them religiously and effectively, you find that they are very effective measures against weight gain. And of course, they are very important for weight management, weight reduction, and therefore reduction in the risk for these non-communicable diseases. So by implementing these strategies, you can significantly reduce your risk of cardiovascular disease along with other non-cardiac causes of death after sudden slumping, and improve your overall health. With these few tips, I am confident that many of you will actually lead healthier and happier lives. So my name is Dr. Obiama Onya. Once again, I'm a chief consultant, family physician. I'm a board certified lifestyle medicine physician with the International Board of Lifestyle Medicine, and I'm the pioneer director of the UPTH Lifestyle Medicine Center. God bless.